And it may have, but the tablets for the amoxicillin didn't matter. I asked you how many milligrams you're going to give the patient. 15 milligram tablets. If you, some of you I think wrote like 12 milligrams, what were you actually answering? You were answering how many tablets you were going to give her, that person. 12 tablets. That's what you were answering. And at that point, we would definitely go to the provider and say, ooh, 12 tablets of amoxicillin, that can't be right. Okay? So I would have accepted if you told me the milligrams, if you told me that you would go talk to the provider after you show me your math, of course. I had one that I saw that was really great saying, here's the 193 or whatever it was, but I would go talk to the provider because we have tablets and this looks like it's an oral suspension, right? Those are that's correct, okay? It is meant to make you guys slow down and stop and think about what you're doing, okay? I still had a couple people not answer why the 6 rights were important. That is just a directional thing, you guys. Okay? I asked 2 questions. You answer 2 questions. Okay? So some of that I know is you guys being stressed out, and I get it. I remember it. I remember being where you guys were and being super stressed out about getting that 100%. But you're going to be stressed in the clinical environment and at work, and you have to learn how to slow down and say, okay, what is this asking? Did I answer it all the way? Because when you get to a clinical setting, it's, okay, do I have the right med? Do I have the right dose? Did I do my math correctly? And stop and slow down and be able to tell the other people in your work environment, shut up. I'm doing meds, shut up. More politely than that. But you get the idea, okay? So we will talk about retake. I know some people were anxious to figure out how they did today. I cannot promise that because I have to wait for the proctors from the distance to send them to me and also review theirs, okay? So I can't promise that you'll have that information today, maybe this evening. I do not plan to be on campus tomorrow at all. I will be, of course, available to you by email, of course. You can always email me. That being said, I don't know when you'll be able to do your retakes. Does Deanna, Ms. Hastings, have you guys split up on Friday? Okay, so if it works out, and I don't know that it will, because I was supposed to go to Helena on Friday, but if it works out that I can be available Friday afternoon, those of you who do not have lab, can you make yourself available if you have to retake it? Because I understand planning, I understand life. Trust me, I'm trying to plan around my life too, so I get it. I get that you were anticipating not having to be here. So if you have stuff, that's fine. But it's kind of like an all or nothing, guys. I can't have 3 of you say, yeah, I can be there Friday, and 3 of you say, no, I can't. Because we have to give it all at the same time. Otherwise, you guys are going to end up writing like 50 exams. I'm not doing that, okay, because I write these. I come up with them by myself. I don't pull them from a bank. So I think I will touch base with Mr. M and see what he sort of thinks is the most appropriate. I know that there's a few that are just like little tiny errors, and I kind of spoke with a couple of people outside after the test. Those tiny errors are what cause big mistakes. So I have a hard time being like, oh, well, you were just off by like 0.2. Well, 0.2 causes the big mistakes. That's when we end up hurting somebody, right? Because any drug in the body can become toxic, right? So somebody did make a really good point that you would have double checks, that you would have a system, you would have somebody else check your math, you would have resources. So maybe that's something we need to talk about. What resources could we make available to you for the retake? Because that is a very valid point. But I have to know that you guys know this. I have to feel comfortable saying, yes, they're safe. Yes, they can give meds in the clinical setting, okay? That's where this comes from. Okay, all right, injections. So go on in there, guys. I'm gonna try to pull this as far as I can. Did anybody have any questions? Distance, did you have any questions?
I know.
What? No? Was that a no? Okay. So let's see here. Ooh. Distance, are you seeing the student?
Yep.
Perfect.
It looks
Yep.
good.
Yay! Okay, like I'm on like a really short leash, so if I yank you off, just, I'm sorry. So these are little injection pads that we can use here today, right? So these just strap on. This one would probably be like your ventrogluteal, right, site. I mean, that's kind of big for a deltoid, although it could happen. You can also, on these, you should be able to give your TB tests on this. We're looking for blebs with those. These are better for a deltoid muscle. There's a whole bunch in here. I would recommend when I'm done showing you stuff that you guys pair up and practice and let me see what you're doing, okay? So these are syringes and needles. Can somebody hand me the like normal saline or something from over there? Just so I don't have to. It's okay. There should be bacteriostatic water. It's the same thing. Okay. Wait. Okay. So, I don't know if these little guys, can you see this distance?
Yeah.
Okay. I don't know if these bad boys will let me do a bleb, but I'm going to try. Can I get your arm? So hold it out like we would a TB test. I don't, this might be too big for that. Can you hold it for me? Okay. So these are our tuberculin syringes. They're super small. They look almost.
Could you have a student step forward like a step? She's just
Sure.
out of the camera. There.
Is that
great.
better? Okay.
Yes, wonderful.
Alrighty. So some of you may have seen these. They're super tiny. This one says tuberculin. The ones that you see now probably won't. They look almost like an insulin, right? Alcohol pads. Can someone hand me the alcohol pads or a alcohol pad? There should be some on the cart or in the drawers. The brown drawers too, guys? Oh, okay. Will you look for more in that brown drawer? Okay, so first thing I'm going to do is wash my hands. Hi, my name is Carrie. I'm going to be your nurse today. I'm going to give you a TB skin test. Have you ever had one before? Yeah. Okay. Do you understand them? Did you have any questions about them? Those are my top questions for TB skin tests, guys, because people don't realize that if they're pregnant, they can't have one. We shouldn't be doing them anyway, or unless you work at like an office where they do them, and then that's a different story. Have at it. But it can sometimes throw off the positive-negative result. So can immunizations. Live vaccines can also do it. So I always ask them, have you had one before? If you understand it, I'm assuming, you know, some places will have all those things on the back of the card, like, hey, do you meet any of this criteria? The other thing is understanding it. Some people will say, I got my TB vaccine today. Well, unless you're from Canada or an underdeveloped country, no, you didn't. You probably got a TB test. So I ask them that question, and if they don't know, then I explain we're just doing a skin testing. This is just a screening tool. I let them know that. It is not diagnostic. If it comes back positive, which means you'll end up with a large rash or raised area, greater than 10 millimeters or 5 millimeters, depending on your conditions, we would send you off for further testing for a chest x-ray elsewhere. Okay, I let them know all that information so people know. Because TB skin tests, like I said, a lot of people are like, I got my TB vaccine today, or I'm here for a TB vaccine. Canada does have a vaccine for tuberculosis. I'm going to swab their skin. Bingo, it is. Did you hear that distance?
No.
Okay, she just asked if it was 10 seconds as well, and it is. So TB, whatever, this is, you're learning. I'm not going to tell you where to stand, guys. All right, so point 1 is TB, right? It's an intradermal. I've got a little bit of an air bubble. This bottle is too big to be TB. They're usually in little tiny vials. Okay. Then I usually like pull back and change out my needle. I don't have other TB needles, so I would pull back, change out my needle, okay? But I can't do that here. So I make sure it's 0.1. I've alcohol prepped her. My biggest pet peeve, after you have swabbed somebody for an injection, do not do this. Okay? You just like ran air over your entire sanitized area. Lord knows what you just kicked up onto the skin. Just wait, it takes 10 seconds for it to dry. Alcohol is a very drying agent. There's no reason to speed it up. Do not blow on it, ever. People do it, nurses do it, do not. Okay, then with this, you make sure that your bevel is up, okay? Distance, can you see that? I don't know where you're at. The bevel has to be up. Okay, your bevel has to be up. You can go, do not go way up here. You don't have to be way down here. It's kind of somewhere in that nice middle piece, and you're going to pull the skin kind of nice and tight. Like I said, I don't know if I'm going to end up with a bleb or not. This is that nice, small, just 15, right? You go barely underneath that skin. You can lift it back up to know that you're like not really under there much. And then I usually just switch hands and then inject it. And I'm not going to end up with a bleb on this stuff. So it just kind of pokes a hole in it. So what you would end up with is that nice bleb that you guys all should have had when you had your TB, right? So the real key with intradermal is that it's just barely under the skin. I mean, it is just like a little poke. That's also why people will kind of jump at you when you do it, because it hurts, because it's just that top layer of skin. It's real irritating. I do let them know if they've never had one, this does hurt a little bit because it is an intradermal, and let them know, do not jump from me, because if they jump and you poke them and they pull back, you've got to start all over. You cannot re-inject, right? You never, if you've poked anything, I don't care if it's a TB, if it's an immunization, if it's a Demerol shot, you never use that same needle again, right? You have to start all over. So it's really important that people hold still for you, okay? Any questions with the TB? I know it's hard to see on this because you don't get a bleb. Most companies' policies are that you need to do it, you need to place another one. You didn't do it right. Sometimes, like I said, pulling that skin like this, nice and taut, helps for you to see it going up a little bit higher out of this little area, but not too high because then you're going to hit a vein. But just kind of right in this area is perfect. And like I said, just pulling that skin nice and taut, trying to get that bleb. When I do go under, I usually do pull my needle up just a little bit to be like, oh, yep, okay, I'm there. And then I push. And I do stabilize my needle like I did when I switched my hands, because otherwise you got a needle flailing there, or you go to push it and it's like, it's really uncomfortable for the patient. Because like I said, you're just barely under there, so it can be a little bit irritating for patients. So.
Is it on this side or the other?
No, it's always on this side. Okay. It is always on this side of the arm, okay?
If you do have one, say I go to give an injection, just like a back.
Sure.
And you poke them, and then you have a kid swat you and knock the needle out. You have to do like 3 drops of like the actual vaccine and everything, get like a whole new, or can you just use up the needle and?
Sure. So just since the question was if a little kiddo like knocked your vaccine out of their deltoid muscle when you were trying to give it, first of all, when we get to kiddos, I will show you ways to prevent that from happening, but it does happen. It becomes sort of a clinical judgment. How much of the vaccine did they not get? Did you push a little bit and like some dribbled down, and so now you're not even sure if there's 0.5 left in there? Just go get another vaccine. Right. Well, that's not true. Any drug is toxic.
Right, okay.
But you never want to under, you know what I mean? And if you like went to do it, like you went to give it and they hit it here, I would say you could probably switch out the needle depending on your type of syringes. Some syringes, they'll kind of bleed all over and then just start over again. So it's kind of up to those sorts of factors. Okay? All right, so you can switch it off with somebody if you want, or I'll just keep injecting you. Okay, so now go ahead and put it up in your deltoid. So these came together, and I don't know. Ooh, 18 1/2. You would not use this for an IM injection. What is this one? 22 1 and 1. Okay, so none of these would really work for an IM. But this is what I was talking about. Can you see me distance?
Yep.
Okay. When you're opening your packages, you open them away. Don't touch it. And then you're going to hook it on. Okay? That's how you do that. Now, this needle can be used to give an injection. Not if I draw up with it, but it can be used. I think these are capped ones. We had slide ones, so hang on. Yeah, so you just, that's how you cap that needle, okay? I'll just take this one. Here's the needle it came with. So, okay, you really need alcohol pads. They should be in the brown drawers, in these brown drawers. There was a whole slew of them in here the other day. Huh? Oh, thank you. Okay. Drop them. Okay. So, we're going to swab the shit out of our vial. Again. And practice counting to 10. I know it seems silly, but practice counting to 10, okay? I usually draw mine back, like say we were giving 3 mLs or something, and then I pull my cap off. I mean, that's personal preference. And then you're going to inject your air, right? And this one might do it for you guys. Yep, so it's not giving me as much resistance as if I didn't put air in it. So I kind of drew it fast. If I had drawn it up slower, I probably wouldn't have ended up with all those air bubbles. Now, when you're measuring liquid, it's the top of that plunger, right? It's not this bottom, right? Yeah, not necessarily the pointed cone, but just the top of the plunger. So that would be 3. Okay, distance, that would be 3. Does that make sense, guys? So it's not the bottom, it's that top layer. That's the amount that you have in your syringe. Okay, does that make sense? Okay, your arm. Yeah, so, man, this is a giant needle. You would not use this for an IM. I don't know what you're using that for. Okay, so I will show you, is that a t-shirt? Yeah. Can I have you take it down on that arm? Okay, so landmarks. What are your landmarks for your deltoid, for giving an IM in the deltoid? Right, but what's your landmark?
Oh, that.
Yep, yeah. Yep, okay. So you're going to find that and go 2 fingers down. That's usually about the correct spacing. I'll have you turn. You find it, find the bone, not just the shoulder. Find that bone, the acromion process, right? And go 2 fingers down. Yeah, acromion process, 2 fingers down. Now, a second check that I always use too, I do this, I still do this with people because it's habit at this point. So I still do this, and then I kind of squeeze them too because I make a little triangle in my, sorry, my hands are so dry that I scratched you, but I make a little upside down triangle in that deltoid. I know there. Like I said, this is too far down, this is too far down, this is too high. It's right here, okay? So, okay, you can turn to the other side. I'm not going to put it in the So we're going to pretend like I did all that on this arm, right? Because that pad is ginormous. So it's the same thing. I do 2 fingers down and then I find my spot. I do that for everyone. Scrub it. Right? Then you're going to enter your patient's room with this like capped, right? You're not going to walk down the hallway with it. And I don't know how much of this is going to go in because this is like a really big needle. So what I do is I squeeze that skin, right? I find my landmark, I squeeze my skin, and then I inject and I push. Okay, I'm not going to keep pushing because it's obviously not taking the fluid. But does that make sense? I really caution against this method for like so many reasons. Okay, distance, are you seeing what's happening?
Kinda.
Okay, so I always squeeze up their skin and then push in and then inject my med, and I kind of let go of their skin when I do that. I caution against, you can still find their skin, do their skin, bunch it up, against this, and then getting on the plunger, okay? Because for several reasons. First of all, this is scary for like anybody. Secondly, when you get to here and you release it, you've got this like needle that's doing all this jazz, and then you're gonna get behind it. When you come at it this way, you're in full control to administer that all in one swoop. It helps with kids, right? Because they don't have time while you're trying to get behind it to squirm out of your hold, right? You've got them the entire time. So I just do that for everybody. That one slides. So I just use that technique for everyone, for any IM injection, because coming out, I don't know when the darting started. I've seen it with a lot of nursing students from other programs when they've come to the health department. It makes my skin crawl, because I just cannot imagine, like, what if you miss? What if that kid swats it right as you're coming at them? Like, if I'm in full control and it's all one smooth movement, it's a lot easier to control something if something bad is to happen, okay? But like I said, I'm not sure who taught that. Somebody taught it, and it's like sticking, and it's scaring the bejesus out of me. So, all right, now I need to move to a sub-Q side, and we'll give you some insulin.
Where do you want?
Just turn it, right? Because your sub-Q, I'll have you do it, and then I'll. Thanks, guys. So here's your insulin syringes. Have you guys all seen these now that you've been in clinicals? Distance, have you guys seen these?
Yes.
Okay, I figured. You haven't seen them? Okay, so they're super tiny, and you pick them based off of how many units. They have other ones. This is just 50, and they're really, really small. And sometimes you will only be giving your patient like 3 units. You have to really get up in there and find where 3 units is, right? It's going to be just like right in there, and sometimes it's 1 unit. Super tiny, it almost looks like there's nothing in there, and you're asking yourself, why am I giving this patient 1 unit? It looks like nothing. But it is important that you also have another nurse check you, right? Insulin is always checked by another nurse, okay? Always. Doesn't matter how busy you are, you find a nurse who can check you, okay? Because insulin is scary. No, it's fine. But you always have it double checked. So we're going to say this is our insulin vial. We're going to take it out of the fridge, unless it's in the med cart, which I guess that's how some facilities are doing it, which is fine. And we're going to take, let's say we're going to give her 5 units. She was like 140 at lunchtime. So I'm going to pull back. I always pull a little bit more because insulin is also one of those thicker ones. And then I just push kind of back in. And then I'm going to go into her room. All right, so with subcutaneous, sorry, can I have you hang on? You're going to try to find the fat on the back of the arm, okay? And just squeeze there and you'll find it. So turn this on. So we'll just squeeze right there. That's about where that sub-Q tissue is, okay? If you were to go a little bit lower, it would probably be okay, but we want it up high. That's where that subcutaneous tissue is of the arm. Okay, are you guys able to see it? Okay. All right, so I go into her room, say, okay, Daddy, what's your name and date of birth? And she tells me, and it's right. Okay, well, I have 5 units of insulin for you today. I'm going to put it in your right arm today because the nurse documented that yesterday at this time she put it in your left arm. So I'm going to use your right arm because we rotate sites. This isn't in the best spot, but I'm going to pinch up that, and you're going at that same little 15-degree angle, right? I'm going to go in and then just push it, okay? And then you just pull out, slide those up. Those all slide the same way. Those aren't a trick, okay? Okay?
So TB 15 as well?
Yep.
And this one you go deeper.
You go 45. Sorry. Did I say 15? Yeah. 45. I'm so sorry. That was confusing. 45. Oh, sure. Let me just get a different syringe. I'm not going to put anything in this one, but okay. And I would squeeze it up, and then I'm going to go with that nice 45, doop, and push. Okay? You can release or whatever. Some people like to rub their insulin in, that's their prerogative if they like to kind of like rub it. Some people do that with Lovenox as well, which is for blood clots. It's fine, doesn't hurt anything. With immunizations, it's the same thing, right? Just a longer needle. You're still going to go into the subcutaneous. You're doing that for varicella and for shingles and for polio when it's on its own. So those are our 3 subcutaneous immunizations, okay?
I had a question about the needle.
Yes.
Does it go all the way in so you can't?
Yes and no. Yes, in like a healthy individual like this, if you were to push all the way in a little 80-pound, 90-year-old, you may hit a bone, okay? So that's why in those 90-year-olds, I really make sure I scrunch up because then I'm going just here. Now, that needle is insanely long. I would not go all the way in with that needle. The 25 and 1s and 25 and 5/8, they're appropriate. So then in that instance, yes, you should go to the hub of your syringe. Does that make sense? Does that answer your question, kind of? Okay. I'm trying to think, what else did I need to show you guys? Those are all the ones. There is stuff for reconstitution here. Okay. I think there's a couple of them if you guys want to practice that. Oh, I know. This guy, I got this guy for a reason. Okay. Distance, I'm bringing you with me. Oh, no, I'm not. It's okay. It's all right. We're okay. And reach, yeah, okay. So, I don't know what you guys can see, distance, nothing, me. Can you see my little sim man?
Yep.
Yay, yeah. Okay. So, sorry guys, my back is going to be to you. But here's my ventral gluteal. You could argue that you're probably going to hit the rectus femoris potentially on this site too. Your ventral gluteal is usually more right here. Oh, I think he just got Sim baby ready. Otherwise, I would have you grab me that baby. But I think he just got him ready. With 90 degrees with those kiddos, you're going right there, right? You're not going to go off to the side unless it is a varicella or a live vaccine for somebody who's just turned 1. That is because your varicella is subcutaneous, then you're going to go at an angle, right? Because it doesn't matter that it's in this major muscle. It's still a subcutaneous vaccine, so it's going to end up going at the 45, okay? Does that make sense? You always think about what kind of an injection it is, not like the fact that it's going into the leg. Does that make sense, that clarification? Okay, so that site is fairly straightforward. Here is that weird one that you guys, can you guys help me lift him over? Right here, okay? On this guy, I would almost fear that you may like hit a bone where that's at, but just for sort of that practice of like, because really, you know, his greater trochanter is probably here. Not, wait a minute. Right? Okay. So just, it's a matter of finding the greater trochanter and coming here and going in between, okay? Does that make sense? Yes. Distance, were you able to see that?
Yes.
Okay.
Yes.
Flip him over. This guy's got a nasty little wound. Yeah, right? On the
vaccines does it say how if it wants to be
Kind of, sort of. So distance, the question was on vaccines, will it say IM or sub-Q? Some of the vaccine boxes will say intramuscular injection. Some of the bottles will. The majority of the time you're going to find that in your doctor's order, and you're going to learn to memorize it. You're just going to memorize it. Okay, my only ones that are live or my only ones that are sub-Q are the live, except for MMR. And, or no, that one is MMR, the combo is not. But anyway, is your live ones plus polio, right? Because measles, mumps, rubella is a live vaccine. Varicella is a live vaccine. Shingles is a live vaccine. Polio is your only oddball. So, okay. All right. Unless there is a live polio, but okay. With oral, I don't know. Does anybody? Many of you are old enough.
like list immunizations, what they are, kind of, does the book have that?
I have to double check, to be honest with you. I don't think that it does. So anyway, so for this one, it's finding that, again, he's not anatomically perfect, but finding sort of that space on the back and coming, I would come down here because he doesn't divot in the right spot. And now I'm on his butt cheek, which is not always the case. So you're coming here and going like right there. Okay, so kind of where his wound is where you would end up going. That's another wound spot. Okay, does that make sense? Okay, so you're kind of finding those, you're finding your landmarks and then finding where you put it. Okay, so that will be important for your checkups. I want to see you find your landmarks. Now the only ones you don't have landmarks for are your subcutaneous and your intradermal because there's no landmark. So kind of, I really honestly go more by like the sort of aligning of that gluteal muscle and then come back. But yes, on this guy, I would actually go a little bit lower than like almost into his back, but most people I don't have to do that with. Okay. With your checkups, I need to know you're looking for landmarks. Even with injections, I need to know that you're asking allergies, names, dates of birth. I will make sure that the MAR for now tells you whether it's sub-Q or IM. Let's see. So for that checkoff, which you guys do have one more lab. Sorry, I was off by a week. So you actually have insulin next week. So we'll go through that next week in lab. But the week after that is your skills checkoff. So in that skills checkoff, it will be an oral medication that you give. You may have a liquid suspension. You will have an injection. You will have potentially some insulin. So you'll have a sub-Q and potentially an IM. I do want to see TB skin. I do want to see that. Just because, especially if you guys end up working in a clinic of any kind, you do them all day. So depending on the clinics, okay, because people go to their providers to get the TB test done. Okay, so we have about 10, 15 minutes left, so you guys can start practicing. You're free to use those. You're free to use anything on the cart. I'm going to go, I believe we have better pads that will actually give you the bleb for your TB. So I'm going to go try to find those. They're just in that closet, okay? All right. So distance, do you guys have a way to practice? Distance, are you able to hear me? Okay.
Yes, I can hear you.
Okay, do you guys have a way to practice?
I don't have anything right now.
Well, no, I know. I mean, are you guys going to be able to practice before I have to check you off, is my question.
I might be able to do a little, and I heard like hot dogs are good ones to practice for TB shots on.
Sure, the only thing is you should not be taking syringes or needles from anywhere. So if you can do it at work, that's one thing, but.
Well, I have a farm. I have
Oh,
transferred
okay.
my cows.
Well,
So.
then I can't tell you what to do on your farm. So, that's fine. If you guys want to practice that way. Was that Conrad or was that Samantha?
Samantha.
Okay, so Conrad, do you guys have like a preceptor that can kind of work with you, or?
Yeah, I can talk to one of them, unless you want me to talk to a specific one, or I don't know.
No, just wherever you can get the, I just don't want you to not be able to practice like the rest of the class does before the checkoff. Does that make sense? Okay, I want you guys to have the same opportunities.
Okay.
Okay, so let me know if you run into a snag. Let them know that you need to sort of observe TB and IM injections and the insulin injections. I'm assuming you're able to view the insulin injections pretty regularly. Keep in mind, hey guys, there is something I want to address too. Sorry, distance, if I'm shouting at you. Everybody, I need you to listen to this. Please keep in mind that injections are medications. Sometimes they get separated. They are medications. So you guys cannot give injections until we get the medication part figured out. And I would say don't give an injection until I've been able to check you off, okay? Now, if you're doing it with your nurse or whatever, maybe we can talk about that. Maybe it's something I need to clarify with Mr. M, and I'm more than happy to do that if there's confusion. But it's considered a medication, right? Any injection is a medication. So you guys can't do that till we've got these tests taken care of, okay?
How about blood sugar tests? Wouldn't that kind of be a gray area? We shouldn't do it? Because I think our instructor wanted us to start looking at that next week with
Your instructor or your clinical staff. That I will clarify blood sugar with Mr. M. That's not a medication. That's an assessment. Yeah, that's an assessment.
Okay.
Yeah, blood sugars are an assessment.
I just didn't know.
I just don't want you guys saying, oh, well, we did injections in lab, I can give that shot. No, you can't. Okay. Not until I can touch base with Mr. M.
Just a quick question. Would you have done any math or just called the doctor right away?
But you still need to do math because I asked you how many milligrams. I didn't ask you how many tablets.
Okay, so I'm not sure if I did it right then.
Okay, I'd have to look at yours, Mercedes. I'm not sure. Okay, so distance, did that clear up everything for you guys? Do you need anything more from me?
I think I'm good. Thank you.
You're welcome. Conrad, are you all set?
I'm not 100% sure, but sure.
Okay, well, what's going on?
I'll be in Great Falls Friday, can I come down then and practice, or?
I'm sorry, I didn't hear the last part of your question. You'll be in Great Falls on Friday?
Yeah.
And what was the last part of that?
Able to practice then with what we're getting checked off on.
When are you coming down for lab?
Yeah.
Okay, and when is that?
It's, I'm not exactly sure. I'll just be in Great Falls all day.
Okay, so, will it just be you, or is Heather coming? Or, yeah, I have Hillary here, the other Heather, right?
Yeah.
Okay, will the other Heather be coming with you, Heather Erickson? What?
Not sure.
Okay, why don't you shoot me an email?
Okay.
And let's talk about figure out what we can arrange between your lab or whatever else you've got to do. And like I said, with these guys, I had planned to go to Helena after my office hours. My office hours are from 10 to 12. So maybe if you're available that time, we could do it then.
I'll figure
Okay.
it out.
Okay, so shoot me an email though, because I will probably forget.
Okay.
Okay, all right. Anything else you need from me? Okay, I'm going to just sign off of this then, guys.